Are you looking for a way to make a real difference in mental health? Thank You Life is here to help. They are a nonprofit dedicated to making evidence-based mental health therapies accessible to those who need it most. At Thank You Life, they provide financial assistance for ketamine-assisted psychotherapy, helping individuals struggling with treatment-resistant depression, anxiety, and PTSD. Their mission is to eliminate financial barriers to these life-changing treatments and ensure everyone has the opportunity to heal. And the results speak for themselves. Their data shows that the average beneficiary experiences a 55% reduction in symptoms, which is on par with the broader ketamine research that we see. If you're in private practice or own a business and want to learn more about how you can help your local community, connect with them today, thankyoulife.org, or email them at partnerships@thankyoulife.org. Again, that's thankyoulife.org, or email them partnerships@thankyoulife.org. Thank You Life, healing through accessibility. This is the Practice of the Practice podcast with Joe Sanok, session number 1044. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast. I am so excited that you are here with me today. We have a great episode ahead of us talking about access to psychiatric services, all sorts of things. We have Dr. Tamir Aldad, who is the founder of Mindful Care. He founded that in 2018 with the mission to bring the urgent care model to mental health. Under his leadership, the company has created the first ever chain of psychiatric urgent care clinics offering same-day, in-network medication management, therapy, and substance use counseling. Mindful Care operates via telehealth in 14 different states. And also, Dr. Aldad holds an MBA from the University of Chicago Booth School of Business and an MD from American University of Antigua College of Medicine. Welcome to the Practice of the Practice podcast. Tamir, how you doing today?
I'm doing well, thanks, and thank you for having me.
Yeah, well, I love that we're talking about access to psychiatric care because I know that when I worked at community mental health, when I had my private practice, that was always in northern Michigan one of the hardest things to figure out. So take me through kind of the problems you see, and then I really want to hear more about this psychiatric urgent care model. But yeah, talk about the typical problems in the psychiatric world first.
Yeah, so by training, I'm an addiction psychiatrist, and then during residency and fellowship, found that access to care was a major issue. We had patients coming to the emergency room at the time, trying to find an appointment with a psychiatrist. Everyone that accepts their insurance either had a 6 to 8 week wait or wasn't accepting new patients, and their symptoms worsened because they had no access to care, and then they would come to us, and either they would meet criteria for inpatient hospitalization, or we would have to send them back out to the community and have them continue waiting. And I found that to be really frustrating, unacceptable, and I was disappointed that I had patients that we could have prevented their mental health from deteriorating, but instead, due to a lack of resources, this was the best we could do. And after I finished residency and fellowship, I was committed to finding a solution where the same way we triage patients in the emergency room, patients could be triaged elsewhere, connected with resources, and given a chance to intervene when they think is the right time and when they're reaching out, rather than waiting weeks and taking the chance of doing worse.
Yeah, so I know that it seems like when there's limited psychiatrists, obviously, like there's big wait lists. So as you see things get worse, what were some of the things that like, for example, you said people maybe needed longer inpatient than they would have had they been seen. What were other ramifications you saw of people not getting access to psychiatric care?
So the biggest story that I usually tell was of a patient that came to us after she came home from college. She found that her mom and her younger sister were in the bathroom. The mom had overdosed on heroin. The sister was trying to call for help when she came home. They were all rushed to our hospital at the time. The mom was pronounced dead, and the older sister was pretty traumatized, but didn't meet criteria for hospitalization. So we sent her home with resources and told her to come back if she feels worse. And we found out 3 days later she died by suicide herself.
Mm.
And it is a real risk that if we don't have resources and people can't speak to a mental health professional and understand how to get care, where to get care, it could end with them being a danger to themselves, a danger to others. They can, if they have a history of substance use, they could relapse. They could pick up substances and self medicate. So there are very serious consequences. And what we're doing as clinicians, before we created mindful care, is just trying our best because we're working within a pretty broken system with reimbursement rates that are definitely challenging. We're not properly incentivized, and the demand is extraordinary. So it doesn't make sense to lose money when patients are willing to pay cash. So if anything, the system encourages us to focus on the patients that can afford care. But what happens there is a huge portion of the population is neglected, and that's who we sought to target. Where is the? If anything, it's more of this kind of bimodal distribution where you have um, access to people who, let's say, have straight Medicaid and have resources there, and they can go to different social services. And then you have people who can afford cash. But the hardworking middle class then is supposed to go where? And that was the question we wanted to answer.
Mm. Yeah, and I feel like the people that this is true in the counseling world too, where those that are good and get full oftentimes then start to think to themselves, well, the hardest insurances to work with, the ones that pay the least, I'm going to start to move off of. Then they end up on just the higher paying ones, and then they move into private pay, and then the access oftentimes isn't there. Uh, for when you started to brainstorm how to address this, doing psychiatric urgent care clinics that offer same day in network medication management, to me, I would just think that you would be full all the time. So, like, how did you structure this out? And like, take me through what that looks like for the average patient that's seeking help.
Yeah, so the model required a lot of engineering in terms of, because we accept Medicare, Medicaid, and commercial, how are we able to get these patients through in a way that's compliant, and we're giving them access to care, and we're providing best in class service in terms of evidence based medicine that's clinically sound, while not becoming just another practice that's fully saturated, right? You have so many components there that you have to navigate to build the model, which is what we spent so much time doing. I would say, without getting into too many details, because logistically there's a lot that goes into it. The goal, the primary focus is triage. Another component is the length of the visit. Another component is the clinician licensure, depending on the acuity and complexity of the case. So the primary thing first is getting the person in to be triaged, right? And assessing the acuity of the case. So we could get someone to see a mental health professional same day, next day. We're very committed to that. We don't want anyone to wait 6 to 8 weeks like they would otherwise. And then from there, we assess, depending on the acuity of the case, where do they best belong, with what type of licensure level, with what level of frequency, with what length of visits, right? A lot of times, if you go to private practice, they'll just do 45-minute sessions or 1 hour sessions or 20-minute follow ups. We don't do that. We have different types of sessions with different types of clinicians of various lengths. So it is a game of chess. I would say that it's challenging, but we've been playing it for 5.5 years now, and last month we had 30,000 visits, and it's pretty incredible to know that these people could have, perhaps not, but could have deteriorated, and could have had to go to the emergency room when they didn't really have to, or might have been admitted to the hospital when they really didn't need to be hospitalized. So preventing all that is certainly something we're committed to. And if you look at the healthcare system, we're decreasing the total cost of care. So if you're familiar with like shared savings model and value-based care, which is a hot topic now, and assessing what is the value add to the healthcare system, we're significantly decreasing the total cost of care, preventing an unnecessary psychiatric hospitalization, preventing an unnecessary psych ER visit. That's huge. So there's upside across the board.
Mm. Now, for these kind of models, our primary audience is therapists, psychologists, counselors in private practice. If they're thinking about this, what could they do from either just a mental health access or bringing something like this to their community? Like, what would you say is applicable for private practitioners that want to advocate for different models of psychiatric services in their communities?
So we work very closely with therapists. Mindful care, even though we have a product called microtherapy, which is 20 minutes of solution-focused therapy as needed. We have group therapy, we have med management. What you'll notice is we don't do one-on-one long-term individual therapy. And the reason we don't do that is out of respect to our referral sources. A great portion of our patients come to us from therapists who provide individual therapy. And we thought it would be really poor sportsmanship if we start offering the same product that they offer. So, as a thank you to our referral sources and our partners, we will never provide that so long as we continue to work kind of symbiotically in that sense. So, what I think to answer your question is in these communities, having a resource like ours is huge because therapists can focus more on doing what they do best, which is providing therapy. And they have the security of knowing that in the event that a patient decompensates, relapses, signs and symptoms worsen, they have a resource where they can send the patient to see a psychiatric professional to evaluate if a higher level of care is needed, if detox or rehab is needed, if med management is needed. So having a resource like ours in all communities, which is at the end, our goal is to have a positive impact on the mental health crisis, would go a very long way. Because I know many therapists in the back of their mind navigate their patients' care through the lens of intervening early, and there's almost this focus that distracts you from providing good care on, well, should I reach out to a psychiatrist now because in 4 weeks or 6 weeks or 8 weeks, this individual might need to see a psychiatrist? That probably is not the best way to see a patient, right? If you're seeing a patient, you're thinking about planning for 6 to 8 weeks from now versus knowing that if we get there, we'll cross that bridge when we get there. The quality of the care is very different.
Yeah. As a therapist, I can tell you from experience that having the right EHR is an absolute lifeline. I recommend using Therapy Notes. They make billing, scheduling, note taking, telehealth, and e prescribe incredibly easy. Best of all, they offer live telephone support that's available 7 days a week. You don't have to take my word for it. Do your own research and see for yourself. Therapy Notes is the #1 highest rated EHR system available today, with a 4.9 out of 5 stars on trustpilot.com and on Google. All you have to do is click the link below or type promo code Joe on their website over at therapynotes.com and receive a special 2-month trial absolutely free. Again, that's therapynotes.com and use promo code Joe on the website. If you're coming from another EHR, Therapy Notes will also import your demographic data quick and easy at no cost, so you can get started right away. Trust me, don't waste any more of your time and try Therapy Notes. Just use promo code Joe at checkout. When you think about what you've seen change as a result of offering this, um, are there any things that have surprised you in that process?
In what sense?
Just in regards to I mean, kind of the old model of, people just having a private practice and people are on a wait list for 6 to 8 weeks to get in. And then offering this psychiatric urgent care model. Are there just unexpected things that in creating a new approach to psychiatric care, that have surprised you, whether that be outcomes, reactions, just anything that
I think,
surprised you?
yeah. Anything in general that surprised me,
Yeah.
I would say it's been refreshing to see patients come um, proactively, right? Meaning, I just lost my job. My girlfriend broke up with me. I'm going through a divorce. Not really sure if I should go to therapy or see a psychiatrist. It's nice to have somebody come and proactively look into it. And then you tell them, hey, your reaction's actually really appropriate, and see how you feel in a couple of weeks. But you seem to have good coping skills, strong protective factors, a lot of social support. You probably don't need anything right now. See how you do in a few weeks and come back to us. Or, it sounds like you really are going through some sort of adjustment disorder, or you really are in crisis. We would love to help you. But I think I've been pleasantly surprised to see people use our services proactively, because I feel like that's how it should be, right? It shouldn't be when almost when it's too late or about to become too late. That's when you start worrying about your mental health. The same way, if you go for routine visits at your doctor, or you have some aches and pains and you go look into it, we're starting to see people with even subtle symptoms come to us, and it's refreshing. It's nice to be able to tell someone, kudos for prioritizing your mental health, and happy to tell you that you're responding appropriately to the situation you're in, and I don't see an issue here versus I do see an issue here, or let's intervene. It's nice to be able to have that conversation versus what has historically been very reactive with like hysteria. That's kind of been the what we're trained to deal with in the hospital.
Yeah, yeah, and then you're not really kind of making your way upstream to look at what's causing these things. Instead, you're just putting out the fires. You're, helping people that are in such a tough situation, and then giving, 15, 20-minute follow-ups once in a while. I imagine that it seems like it's more comprehensive care overall when you've done this. Um, when you have the psychiatric urgent care clinic, is that so do people then follow up with you after that, or is it really kind of meant to be in between sort of ER and
No,
a general psychiatrist?
no, we provide the ongoing care as well. So you'll have the urgent care mental health assessment, which is basically a triage visit. And then based on that, the acuity, the severity of your symptoms, the type of care that you need, we will provide ongoing follow up care. But all of it is a lot easier because people are coming to us sooner, more informed, with less pressure. So it from the beginning feels a lot more holistic and comprehensive versus, like you said, when you're in the emergency room, you just try to find the biggest fire, the biggest problem, and address that. And maybe someone else down the line will figure out if there are any underlying causes.
Mm. Now, I'm just thinking about how if I knew that I could, you know, see someone that quickly and then get in, I feel like that practice would just be so full all the time. And then with the very thing that you're trying to stop, and that's like having a giant waiting list, would then be created. Are you finding that? And like, what do you think you're doing? I guess my real question is like, what are you doing that is removing that barrier? Is it that you just have enough psychiatrists, that you have enough openings, you've automated it through like online? Like what are
Yeah,
some of the things that, yeah.
it's all the above. It's having constantly hiring to remove any bottleneck issues and maintain throughput. It is having various levels of licensure. So you don't always need a PsyD or a PhD to provide therapy. So using various forms of therapists, even on the med management side, not just using an MD or a DO, but introducing psychiatric nurse practitioners, physician assistants to help with prescribing, depending on the acuity and complexity of the case. So various types of licensure, various appointment lengths, various appointment types, various appointment cadences. So it is it's basically modeled around making sure you constantly have staff, right? So we're constantly hiring as we grow and as we scale, and there is extraordinary demand. And then optimizing, not treating every case and every patient and every appointment as cookie cutter. And then um, it's like a game of chess that you're constantly trying to move a bunch of parts, and or Tetris, let's say, that you're trying to move a bunch of parts and making sure they're constantly fit. So if someone does need to be seen same day, next day for an evaluation, you can get them in.
Hmm. I want to pose a hypothetical. Imagine a bunch of, and this probably would never happen, but imagine a bunch of big insurance companies came together and said, Tamir, we want your help in sorting out this psychiatric mental health crisis and access in America. Help us restructure how things are done, barriers that are unnecessary, other than just saying like kind of what you're doing, let's do more of that, through mindful care. What other systemic things do you think need to happen to improve access to psychiatric care?
I think you just got to open a lot more mindful care centers. No, I'm kidding. Um, that isn't really the solution, because mindful care effectively had to. When we came up with the idea, we had to navigate what I felt was a very broken system. So even if, as a joke, we say just open a ton of mindful cares, um, that doesn't solve the problem at the root. I think that at the root, the reimbursement structure is very discouraging. Um, I work with residents and new grads. They're not incentivized to pursue in network care, and the fee schedules and the fee for service reimbursement structure in and of itself doesn't prioritize mental health. So I would say if we really wanted to move the needle, and I wrote an op-ed about this, I think last year, we really need insurance companies and Medicare, Medicaid to acknowledge that these fee schedules are a priority, and acknowledge that if people, you know, take their mental health seriously, and we want doctors to take the patient's mental health seriously, reimbursement needs to be competitive. And then from there, I think we'll see a lot of physicians accepting more in-network patients, and then giving these patients the care that they deserve. I'll give you an example. We had a fee schedule in Florida that we were negotiating, and for 40 minutes of therapy, the the fee schedule had $14 as the reimbursement. So for $14 for 40 minutes of therapy, that means if you um, correct that to an hour, right, you're looking at $21 for an hour of therapy. Now, keep in mind you have to cover your overhead, your EHR system, your rent, your electricity. So that means we need to hire a PhD or PsyD psychologist at the $16 to $18 an hour range, and I think that might even be illegal. I don't know what minimum wage is in Florida, but that could even be below minimum wage. So whoever's doing the math, right? Where am I supposed
Mm-hmm.
to find psychologists in Florida willing to work for $16 an hour? And these people have PsyDs and they're in debt, or they have PhDs. The math just doesn't make sense. So I would say, if you're asking me systemically, what do we fix? It's making in-network reimbursement competitive so people are properly incentivized.
Yeah. Yeah, it's like you look at, different aspect, all sorts of different aspects of medicine or medical, and looking at all the different ways that things are billed. Like I was in the hospital, and there's every little thing gets to be billed. And in the counseling world, that's often really difficult to figure out, and in the psychiatric world, and to even negotiate with these companies. So I'm glad that you're at the forefront of all of this. My next question is the last question I always ask. If every private practitioner in the world were listening right now, what would you want them to know?
I think the most important thing for a clinician, and I try to remind myself of this every day, is to go back to your admission essay to grad school and remember why you went to grad school in the first place, and what was the reason that you wrote there. What inspired you to become a clinician? A lot of times I think the system really impacts our perspective, and I think we need to stay true to, if we took an oath, what was that oath, and remember why we're doing this, and why we went into the world of patient care and clinical care to begin with.
Mm. Well, it's amazing what you're doing, serving over 30,000 patients a month in 14 different states. Tamir, if people want to connect with you, if they want to connect with Mindful Care, where should we send them?
Yeah, we'd love to connect with clinicians. Feel free to visit us online at www.mindful.care, or reach out to me or anyone on my team, and we'd love to work with you.
So awesome. Thank you so much for being on the Practice of the Practice podcast.
Absolutely. Thanks for having me.
Well, we have covered a ton of different series throughout this summer. We kicked this summer off back in May with our psychedelic assisted therapy series that we did, interviewing 10 different practitioners, legal analysts, people who were talking about access to services. So if you missed that, that kicked off back in episode 989. Then we had our summer series on movers and shakers, really kind of big name people that were doing things, people that were working on different ways to think, different ways to grow. We talked to Goop Lab founder Elise Lohan, and we talked to a few different other people that were during that series. Then we had our Level Up Week series that was going just right before these couple of episodes. So all those episodes, all those trainings we did back in the spring of 2024. A lot of you weren't able to attend those live, but we talked about starting a group practice. We talked about staying motivated. We talked about how to transition between your tasks day to day. What kind of things should you be using for your marketing, your networking, all sorts of different things. So make sure you check out those series if you've missed it. We're doing, again, right now, looking at the calendar, looks like 7 days a week. We're kicking this thing. So doing lots of interviews, and so excited that you're hanging out with us. And we couldn't do this show without our amazing sponsors. Therapy Notes has been one of our sponsors since near the very beginning. They're the best electronic health records out there. They have all of your telemedicine in there. You have credit cards on file. They'll have people that help you transition from wherever your EHR is right now. And it's real live people that are helping you. It's not just chat bots. It's not just, texting with people. It's an actual person that'll jump on the phone and help you out. So love Therapy Notes. Head on over to therapynotes.com to read more about them. Use promo code Joe at checkout so that they know their podcast money is working, but also to get that discount that they offer you. Thanks so much for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music, and this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.